Joining us now is pediatrician Dr. Dina Kulik, and thank you, Dr. Kulik, for coming on to talk a little bit about this. So obviously, just heartbreaking to lose a child under the age of 4 to this virus. Is this just the beginning, given the high transmissibility of this disease?
I hope it's not the beginning of having more children get very sick or die. I feel terribly for this family and anyone who knows this family, of course. But as we see this significant burden of COVID-19, particularly this variant Omicron, as it spreads, if we have enough people that get COVID, we will have more people that get very sick and more people that will die. It's just a numbers game.
And are they being left out in the Senate? And what I mean by that is children under the age of 5, because they're not in the vaccine eligibility group?
Of course, they're going to be more vulnerable. Young children, particularly babies, have weaker immune systems than older kids and adults, of course. And because they can't yet get vaccinated, they will potentially get exposed and might get sick with the illness. That being said, the vast majority of children, young babies to older children, do remain quite well with COVID. Very few children have gotten very sick and died, but again, if enough people get COVID, more kids will get COVID. And then the risk to them, particularly being unvaccinated, is that they could get very sick.
And parents of small children, parents of children in general, have been told throughout the pandemic, if your child has this symptom, that symptom, stay home, but they could be cold-like symptoms. What's the advice to parents now that we know that it's spreading in children and whether or not they should assume it could be COVID?
I think anyone with any viral symptoms right now should assume they have COVID. It's that prevalent. There's just that much of it going around. From fever to sore throat to stomach pain to vomiting to just a really little bit of a runny nose. I've seen the whole gamut in the last few weeks in terms of our patients getting COVID. So many more of our patients have gotten COVID day by day. Some confirmed, lots are just rapid test positive at home, and many, many more that don't have access to rapid tests, are not getting PCR tested, but are symptomatic. We should assume that anyone now that has any viral symptoms has COVID, truly.
Is it possible that immune systems in children are even further compromised because they're young, as you mentioned, but also because we've had so many lockdowns that the exposure has been so different to life's viruses in general?
People have been worried about this for the last 2 years. I haven't seen this in practice. When things opened up again in the summer and the fall and kids were back in school and daycare and summer camps, we did not see a dramatic rise in illness. It was sort of as it normally is in the fall. And then, of course, Omicron came and many more kids were getting sick. But I'm not really worried that their immune systems are, damaged or weaker because they didn't have those, few years in the same kind of experience, in a viral experience as they had before. I think, as usual, as we get exposed to things, we develop immunity to those things. And once kids are back together again, they will be exposed as usual. But now we want to prevent any exposure because of just how prevalent this variant of COVID is.
Yeah, and how I wanted to get your thoughts on about the reach out, really the call to people that are pregnant, women that are pregnant, to make sure that they also get vaccinated.
Absolutely. So we've known for much of the pandemic that pregnant people are at risk of getting severe illness themselves. There have been, unfortunately, lots of pregnant people that have died and gotten very sick with COVID. Parents lost, babies lost, but also the risk to transmission to the unborn baby or babies in the early stages after birth. There's a real risk there, and we're only starting to understand this new variant more. We learn more and more every day, but it does seem as though pregnant individuals are at higher risk of severe illness and transmission to their unborn or newly born babies, and that's a big risk.
Yeah, okay. Well, Dr. Dina Kulik, thank you very much for joining us.
You're welcome. Be well.